Started. Welcome to the 5-star back pain class, and today is managing back pain with the foam roller. So I'd like to introduce myself. I think I know most of you, but welcome to those of you who are joining for the first time. My name is Allie. I'm a doctor of physical therapy as well as a nationally certified Pilates instructor. I've been practicing here in Boston for the last 5 years and recently opened my own practice. And I've been teaching with the Community Online Academy a variety of classes since its inception for 14, believe it or not, 14 weeks ago. So today's program is going to be movement-based almost in its entirety. I will save a couple minutes at the end for questions, but I want to get through a lot today, so we'll do a lot of moving around. But one thing I always highlight in all my classes is that you know your body better than I know your body. And I want you guys to be an advocate for yourself and modify things if you need to. So the point of this class is for you to leave feeling a little bit better than you came into class. And so I offer modifications, I offer challenges. If you need to take either of those options, please don't hesitate to do so. So we're gonna now take our rollers. And if you guys are just getting logged in, I know there's a few people just joining. You need a foam roller as well as your mat and some space to move around. If at any point during this class you guys have a question, just write it to me in the chat and I'll read them all at the end and go over any answers. So you're going to take your roller. I will join you back on the mat and lie your roller down perpendicular to your mat and to your spine. And I like to set up by just putting my feet down on the other side of the mat, on the other side of the roller rather, and then lying down onto my back. And from this position, we're actually going to start with the roller underneath our sacrum. So our sacrum, for those of you unfamiliar, is the bony part of the bottom of your pelvis, just below your spine. So you're going to lift your hips up and pull the roller closer to you and place it under your sacrum. So it should feel relatively supported once you set up, and you can always roll around a little bit to find that sweet spot of what is comfortable for you here, but you're going to start with your sacrum resting on the roller. And the reason we do this is because our hips now being higher than our shoulders creates a decompression of our spine, so very slight inversion. And what we know is that over the course of the day, because of gravity, our spine experiences a low level of compression, and that compression increases when we sit. So by just resting your hips up on this little bit of a higher surface, this could also be, you know, a yoga block or something like that, we get a little bit of decompression. So I'd like to start here, just letting your back relax and focus in on your breathing. You can even rest your hands on the front of your rib cage and very gently feel the rib cage opening. And as you exhale, feeling the two ribs gliding together. Feeling the ribs open and exhaling to glide them together, and just letting your spine relax, letting your body melt down on the mat. Nice and easy, maybe adding a small tuck to your chin, lengthening the back of your neck. And we'll try one more big breath here. And then we'll go into our first stretch of the day, which is for our hip flexors, the front of our thighs. So I like to bring my right knee in towards the chest first. You're gonna hold that knee gently with both hands and stretch your left leg out long. So by having the shape of the roller here, we get a little opening of the front of our left hip. And if you're not feeling that, bring your left leg a little closer to the midline of your body, so over to the right, and push your knee down towards the floor on that left side. You can also hug the right knee in a little bit closer, and that should feel like a deeper stretch through the front of the left thigh. And if your foot is not on the floor on the left side, that's okay. That just means you're a little bit tight there. This is a good stretch for you to practice to open up the hip flexor. So we'll hold for one more big breath here. And then I like to switch sides by bringing the left knee in first and then stretching the right leg out long, doing the same thing here. So drawing the left knee in as close as you can, bringing the right leg to the midline of the body, so shifting to the left and pushing the knee down towards the floor. to feel the opening through the front of your hip. And just breathe. This can be fairly intense, especially if you're coming off a long bout of sitting. And we'll just let our body relax on the mat here. We'll take one more deep breath. And then bring both knees in towards your chest, very gently massaging your spine side to side. Maybe you hold onto the roller here if that's comfortable. And we'll go into our first strengthening exercise of the day, which is for our core. So we're going to line up in tabletop, which is where our knees are right over our hips. And I do like to hold the sides of the roller for this one. Let your shoulders relax onto the mat. Close the front of your ribs so that the back of your shoulder blades are down on the mat. And then slowly we'll press one leg out to the over the roller and then the opposite. To modify, you're going to press up a little higher towards the ceiling. And for a challenge, you can press down a little bit lower. So you should start to feel your core muscles working to keep your ribs and the back of your shoulders on the mat. And it's kind of nice to work your core in this decompressed position of the spine. Just another way to add some length to the muscles in the area, as well as manage any compression around the vertebrae. 5 more. And 4. That's it here, guys. Last 3. And 2. One more time. Bring the feet down. Now you can use your hands to push that roller out from underneath your hips and drop your hips down onto the mat. So we're going to prepare for our second strengthening exercise, which is a bridge. And this is optional, but if you want to try, you can rest your feet right on top of your foam roller. So I like to let the arch of my foot rest and drape over the roller. And then your goal is actually to keep the roller still. So you can move the roller around and see how easy it is for it to move. When we do the bridging, you want to push down into your feet to lift up, but keep the roller rather still. And then try lowering your hips down, pressing the hips up and lowering down. Now this should be work for your butt muscles, your hips, and you will also feel some work in your hamstrings. If it feels like your hamstrings are going to cramp, imagine hugging a ball between your knees or a pillow and try and keep your knees a little closer together, and that should help you manage some of that hamstring work. Now, you also have the option to just put your feet flat on the mat and practice the same exercise, and that's a little regression from this work. Now, try holding the hips up on this next one and just holding here. If you want to build in one last challenge, you're going to purposely roll the roller 1 inch in each direction, but keep your hips lifted so your butt muscles are active. They are not dropping down as you move the roller. We'll do 3 more and 2. Last time, drop the hips down, and stretch the legs out long. Nice job. So we'll sit on up, and we're going to take that roller still perpendicular to the spine, but now it'll go behind us, and we're going to set up to place our shoulder blades on the roller. So I think the easiest way is to kind of hold the roller still with your hands, rest your shoulder blades, and then hold your head with your hands, bending your knees. So a couple form things to think about. We're going to do some rolling on our spine, but I only want you to roll to your rib cage, the bottom of your ribs, and to the very base of your neck. So from the base of your neck down to the rib cage, but no lower than that. So what we'll do is make sure your head is heavy in your hands, plant your feet, lift your hips up, and then we're just going to roll back and forth. And what this initial rolling does is it starts to loosen up some of the muscles that surround our spine. But it also serves as a nice way for us to assess and feel where the tight parts of our spine really are. And you'll notice that pretty quickly. Again, there's really no right or wrong way or spot where you need to spend a little bit more attention. Everybody's body is different. But common areas that I see are sort of way up at the base of the neck. People tend to be tight, and then down just below the shoulder blades as well. Now you might get some cracking or popping in your back when you do this, and that's normal. It might actually be a good thing that you're getting some movement at those joints where your rib cage meets your thoracic spine. So just nice and easy, head is supported in the hands, still rolling back and forth. You can challenge yourself to go down a little bit lower and then coming all the way up to the base of the neck. Good. Now, I asked you guys to check in and see where those tight spots are. We're going to now use one of those tight spots to build on this exercise. So pause the next time you're in an area that's a little bit tighter, and you're going to place your bottom down, bring your elbows nice and narrow, and actually let your chest drop back over the shape of the roller. Now, a couple things I like to note here. Your rib cage in the front is going to want to pop up and flare up to the ceiling, but you'll actually get a deeper stretch if you can pull your rib cage down towards the floor when you drop your spine over. And it might feel like you can't go as far, but that's okay. You're actually getting a better stretch. The other thing I see is that a lot of people let their head hang back. That's not a bad thing per se, but that's a big stretch for the neck when we're trying to target the upper back. So you want to keep your head in your hands. One of the easiest ways to know you're not stressing your neck is to make sure you can still see your knees when you lean backwards. And then in this position, just breathe. See if you can hold it. Again, we're stretching around that thoracic spine where our rib cage connects. So with a big breath, we actually get a deeper stretch. Go ahead and lift up. We're going to find another one of those tight zones. So you can roll just a little bit to find that second tight spot. And then go ahead and again, lean back over the roller. And you can either choose to kind of come in and out of that stretch or just hold that stretch back, whatever is comfortable for you. But no matter what position you're in, continue with that natural, comfortable, big breath. So allowing the spine to lift and then lowering back into your stretch, but pulling the front rib cage down. We'll do one more time here. And then I'm going to show you guys, you can stay on the roller, but I just want to show you for a moment how we're going to build on that stretch. So we're going to add in rotation, which is lifting one elbow up towards the ceiling. And then we're also going to add side bending, which is dipping one elbow down towards your hip. So I'm just showing you guys this in sitting so that you know what it looks like. We're going to do it down on the roller. So the first one we'll do is side bending. And so on the roller, you're going to still hold your head in your hands, but bring your left elbow towards your left hip. So you're making an arcing motion and it should open up the right side of your body. And that way you can start to be a little bit, you can get deeper into your right side with the rolling, even with the leaning back. You can also then switch over and bring your right elbow towards your left hip and open up the left side. And this is a nice way to start to really notice side to side differences. For me, the right side feels much tighter, so I'm going to spend a little bit of extra time managing the right side. And that's up to you guys. You have the flexibility in this little program here to spend a little bit more time on the side that feels like it needs more attention. Now to rotate, you're going to bring one elbow higher to the ceiling. And what that's going to do is it's going to start to bias the rolling into your latissimus, the lat muscle, which is often thought of as a shoulder muscle. But believe it or not, the lat connects all the way down to your low back. So by mobilizing the tissue of the lat, you can make your back a little bit more flexible. And this can be quite intense. So I'm going to go ahead and switch to the other side. So be gentle. You can always put your bottom down and take a rest, but work to roll out those lat muscles. And again, you'll find probably one side a bit tighter than the other. You're rotating to try and aim the opposite elbow up to the ceiling. Breathing, maybe you focus in a little bit higher to the shoulder. Maybe you're focusing in down a little bit lower on those side ribs. And we'll spend just another moment there. And then very gently plant your bottom down and come on up to a seat. All right, so hopefully your spine is already feeling a little bit looser. I know mine is. And it feels like maybe you can sit up a little bit taller, even take a deeper breath, and you can test that right now. We're going to get into a little bit of work that helps to stabilize your spine. So build strength around your core. So in order to do so, I'm going to turn my roller lengthwise so that I can lay along the shape of my roller with my spine. This is where having a shorter roller, you're going to need to modify a little bit. So to get on the roller, I find that sitting right on the end and then walking your hands back until you can lie down so your spine follows the shape of the roller. If you have a shorter roller, I'd like your head and your mid-back at the very least to be on the roller. You're then going to need to use your legs to hold yourself up from your hips down, or maybe put a couple pillows underneath your hips. So you can find what adjustment is comfortable. But while you're laying here on the roller, take a moment and just settle in. So the shape, the really straight nature of this roller is going to hold your spine in a neutral position. And I think for a lot of us, we're not spending tons of time in that neutral position. So just take a moment to notice how your spine feels on the mat. Maybe you even open up your arms out to the side and allow yourself to feel a pec stretch across your chest. And just breathe. See if you can still have the feeling of pressing the back of your ribs into the mat so your core is lightly engaged. And then we're going to use this to kind of figure out where our spot of balance is, or maybe where we're a little bit off balance. So walk your feet closer towards one another, about hips distance apart, and then lift your arms up to the ceiling and just get your balance here. This can feel surprisingly wobbly, and I think pretty quickly you'll see which side your body is favoring and which side is doing a little bit more work. You might have way more weight in your right foot than your left, or vice versa. You might feel a lot of wiggling and wobbling through your rib cage. So let your body just get centered and settled. And then we're going to challenge this movement a little bit. So bring your fingertips down to the floor. And this is truly just your fingertips. It's not my whole arm on the floor. I like to say I'm making little tents with my fingers. From here, we're going to start to lift one leg at a time. And this alternating leg movement is really what it looks like in a smaller scale when we walk. So we're lifting one leg at a time. And I want you to feel how stable your spine is as you do this little lift. So as you march, you might find, wow, it's really easy to pick up one leg, but it's really hard to do the other. If you're feeling pretty confident here, go ahead and try picking up one of your hands and holding it off the mat and see if you can still balance on your roller. You can also try the other hand. And usually the other side is always a little bit harder because our body likes to pick the path of least resistance to start. So test that out. Maybe if you're feeling really confident, you can try with no hands, so reaching both hands up. And this is something that took me lots and lots of practice to get stronger at and to get good at, to feel comfortable. And you can see one side for me is still much trickier than the other. And if you fall, that's okay. You're not up too high. You can always bring your hands back down. So this is looking at the stability of our spine when we're walking, or even when we're going up and down stairs. We're now going to look at the stability of our spine from our arms. So from here, plant both feet and lift both arms back up to the ceiling. This time, instead of moving your legs, you're going to let one arm drop out to the side and then the other. So nice and easy, one arm out to the side. And I really don't care how far your arm goes. You're just lowering your arm as far as you can without falling off the roller. And this is what it might look like when you're moving your arm to, say, pick up a really high dish out of a shelf, or kind of move something, push or pull something with one arm. How stable is your spine? Give this a shot here. We'll try 3 more. Good. 2 more. Can you glue the front of your ribs down? And 1 more time. Good. Now gracefully roll off the roller. And really, there is no graceful way to do that, but thankfully you are not super high from the ground, so you can just gently roll off the roller. And we're going to use the roller now to get a little bit more into the soft tissues, so the muscles that surround our spine. The first one we'll do, we'll actually turn the roller back to that perpendicular direction to our spine, and we're going to work our calves. And the reason we focus in on the calves first is a couple things. One, our calf muscles are our first shock absorber when we're walking. So if you've taken my back class before, you know I feel that having good, strong calves is really important to shock absorb our body weight before our back has to do the shock absorbing. The second reason is the nerves that exit our back, they run all the way down the back of our legs, all the way into our calves. So by improving the mobility of our calf muscles, we may be helping any nerve sensitivity. So I'm going to walk my hands about 6 to 12 inches behind my bottom. I'm resting the meaty part of my calf right on top of the roller. And then I'm going to pick my bottom up and start to roll from the back of my knee all the way down to my ankles. And the fun part is that this also doubles as a little core exercise and shoulder exercise to create the movement here. So again, you might find certain spots are tighter than the others. If this does not feel like enough pressure for you, you want more pressure, cross one ankle over the other. For me, that feels much too intense, so I like to stick to both legs, but you can always try that, and then you would go ahead and try the other side. And that may reveal, again, some side-to-side differences. The other variation you can do is to turn your legs to get the inside or outside part of your calves, and then turn once again to do the opposite side. So sometimes we find more tension, let's say on the inside or the outside, depending how we walk, how we strike the ground. And just nice and easy, exploring that movement. You can always take a little rest, put your bottom down if your wrists are getting tired. You can actually do this down on your forearms as well. It's a little bit harder to create that movement, but if you're somebody whose wrists are really sensitive, that might be a good option for you. So something worth exploring. So we'll spend just another moment or two there. And then I'm going to have you guys bring the roller in close so that we can start to get into our glutes, our hip muscles. And again, our glutes are, the nerves also run through our glutes. You may have heard specifically of the piriformis. The sciatic nerve runs right through the piriformis, so we'll address that here. But also our glutes are really important to support our spine when we're squatting and when we're bending over. So you want to have good flexibility to be able to recruit those muscles. So we'll sit right on top of the roller. And then in order to bias one side, I'm going to tip both of my knees over to the left and plant my left hand down. So both knees over to the left hand is down. And then you want to be on the meaty part of the muscle. And I know that sounds funny, but there are also a couple of big bones in your hips that if you roll over those bones, it's not particularly comfortable. And you might actually be a little bit more sore from doing that. And the reason being is you have what's called a bursa on top of those bones. The bursa is a little fat pad that's there to protect the bone from the tension of the tendons around it. And the bursa do not like to be massaged. They do not like to be rolled over. So try to stay away from the big bones and keep the rolling to the meaty part of your muscles. That being said, you can really roll a little bit to the side and get the side hip muscles. And this is one I like to highlight. If you're somebody who has IT band symptoms, which is down the side of your leg, or knee pain on the side, you want to get these top hip muscles. This is the way you can make change to the IT band. So these small side hip muscles, they attach to the IT band. So by keeping these pliable, you will make an effect all the way down the leg. You can also turn to face more up to the ceiling to get more of the glute max, the central part of your glutes. And then we'll go ahead and switch over to the other side. So now I'm going to tip my knees to the right and get into those right hip muscles. Now again, if you want more pressure, this doesn't feel like enough, cross your left ankle on top of your right knee. And for me, I always say, wow, that is a little too intense, but you are more than welcome to try that if it feels like something that you can tolerate. And again, you can rotate and really work to get the side hip muscles, or you can center yourself a little bit and try and access more of that central glute max, which is that meaty part of your glute right in the midline. You can, if you feel one particular spot that's super tight, you can always pause on that spot, spend a moment or two there, and then continue to roll. And I know we're going through this a little bit quickly. You can certainly spend more time if you feel a certain region is much, much tighter than the other. But I just like to show you guys at least the technique so that you can then go back later and get deeper into that little zone. So you really can foam roll anywhere from 1 to 5 minutes on a certain area, depending how tight it is. So the last spot I want to show you guys is on the quad, so the front of your thighs. And so the setup for this one's a little bit funny, but you're going to turn and we're going to actually go sort of like mimicking on our stomachs. So I like to bring the roller up to about my knees, and then I'm going to walk my hands forward onto my forearms and start to put the weight on my knees, rather on my thighs, so just above the knees. Now you can keep your toes tucked under and actually use your toes and your arms to sort of army crawl yourself forward and backwards. Now, if you can tolerate it, you can lift your feet right off and do all the moving just from your shoulders. And I encourage you guys, when we're here working on the quads, don't treat it just like a stretch. This can be a little exercise too. Still work on keeping good form from your spine by drawing your rib cage in towards your spine, pushing your elbows down into the mat. Now, maybe you're more tight on the low part of your quad, which is down just above your knee, or you might be a little bit tighter all the way up, closer towards your hip. So just explore that. And just like we have practiced on the other exercises, you can always cross one ankle on top of the other to put more weight on one side. You can also rotate a little bit to twist and get the outside or inside part of your quad. And our quad is called our quad because really it's made up of 4 smaller muscles, and they go all the way across the front of our thigh from the outside to the inside. So one might be tighter than the other, and you can just explore that by adding in those little bits of rotation. So we'll spend just another moment here. And then gently you can kneel down, walk your knees in, and come all the way on up. I'm going to show you guys one more, which is for your upper back. Really, it's a little bit of a shoulder stretch, but it's good for your upper back. So we're going to stay in this kneeling position. You can actually even sit if kneeling is not in your practice. Place your hands on the roller and just roll the roller forward and then lift it back up. Rolling the roller forward, you let your head drop down between your shoulders and lift up. So if you're on your knees, it looks like almost like a child's pose type stretch. So reach fingertips forward, head down, and then lift all the way on up. We'll try one more there. And then all the way on up. All right. Nice job, guys. So let me come in. I see maybe 1 or 2 questions here in the chat. We have just a moment or two, and I'd love to answer any questions that you guys have. I hope you're feeling a little bit looser and that you have a better understanding of how you can use your foam roller to help manage back pain, but also any other sort of conditions related to the back. Since we are a nice small group, if you guys would like to unmute yourself, you are more than welcome to do so and ask a question. If you'd rather write it to me in the chat, that's also fine. The question that I have here right now is, what diameter foam roller do I suggest? So almost all foam rollers, believe it or not, are the same diameter. They're 6 inches. That's sort of the standard, but they do make different lengths. And so the length of the roller I have is 36 inches. Which is pretty much the longest one I see that's traditionally out there. I like that one so that I can lay on it for the length of my spine, but they make rollers anywhere from 12 all the way up to 36 inches. And that 6-inch diameter is pretty standard. I also had a couple questions in my last class about whether or not the density of the roller matters. It does and it doesn't. You can do all these exercises with a low density or a high density. The one I have is a high density, and it's just a more intense experience. So it depends on how comfortable you are with these exercises and how it feels for your body. Different people have different sensitivity to pressures and things. You can do this whole routine with a low density, and it's just going to be a little bit less intense. So any other questions I can answer for you guys? Thank you so much for coming.
I can't believe it's already done. Like the time went so fast.
It does go by so fast. I know, it's hard to believe. 30 minutes, just like that.
Yeah.
Thanks for
you.
joining today, Mark. How was the longer roller? Did that go okay?
Oh, a world of difference.
Awesome. I'm glad you like that.
Yep.
Great. All right. Well, guys, let me, I do ask, Karen, did you have a question? I'm sorry. Oh, maybe you're frozen there. Okay. Oh, Karen, did you have a question?
Can you hear me?
Yes.
Okay. What about a crunching sound when you're doing the roller on, I guess it's maybe like in the shoulder blades. I'm not exactly sure what's crunching.
Yeah, that's a good question. So it might be a couple things. If you feel more like a popping, that's usually the joint. And the reason it makes that noise is because in between each of our joints, we have fluid. It's called synovial fluid. And when we move that at a high velocity, it changes to a gas, and it makes a noise when it does that. And the gas takes up a little bit more space than fluid does. So that actually means that you're getting some movement in the vertebrae, which is a good thing. So that's the popping noise. If you're feeling more like crunchy, crackly, that's usually the fascia. And the fascia I like to describe as sort of like, if you could imagine all our muscles in our body, there is like a saran wrap that surrounds all our muscles that holds them in. That's the fascia. It's the most superficial layer of our body underneath our skin, but between the skin and the muscle. And so that can make, when that gets tight, you might feel a little like pops, almost like bubble wrap when you're rolling up and down. So that's probably indicative of more of a fascial tightness.
Okay.
Also a good thing though.
Okay. And just rolling that out is the best thing for that?
Absolutely. Okay. And I think you'll notice as you continue to do that, you're not going to notice as much cracking and popping. Like the first time everybody does this, they're like, oh my gosh, this is the craziest sounding thing. And it gets a little bit better with time. But also know if you've done a lot of sitting, you've kind of been bent over for the course of the day, you're more likely going to hear crunching, cracking, popping when you do these exercises because it's just a position you haven't been in a little while. Yep. So what exercises can I recommend for sciatica? So that's a bit of a loaded question in that sciatica can be caused by a number of different things. I always like to say that sciatica in many ways is a symptom of something. So sciatica might be caused by a disc herniation, it might be caused by a bony osteophyte, it might be caused by something more peripheral like a knot in your muscle. So depending what's causing the sciatica, I could give a more clear answer, but what I can tell you is that keeping your spine flexible, keeping your spine strong, really everything we practice today should be beneficial. The only one I will caution you on if you're having an acute bout of sciatica is stuff that's bending forward. And so the one we did today that's bending forward, let me move so you guys can see me, would be when we were rolling the calves. Just the position we get in is kind of a bending forward position. That can possibly be a little irritating if you have an acute bout of sciatica. So that one may be something that is worth skipping or modifying for the time being until you're feeling a little bit better. So hopefully that answers your question. Awesome. So let me show you.